There we go. So I'm a surgical oncologist at the University of Colorado. Thanks for having me today. We're going to be talking about evaluating unconscious bias. So there are several different types of bias and microaggressions. What we're specifically going to be talking about today is unconscious bias, which are deeply ingrained beliefs and learned stereotypes that are automatic and unintentional. They occur below the level of consciousness, and they naturally happen as we categorize experiences. And this is based on our past experience and is not necessarily rooted in ill will. There are other types of bias and microaggressions which are important, but we're not going to be covering those today. So bias can manifest in how we address each other. So I want you all to ask yourselves, why do we address some people casually, first name only, and others professionally, doctor, last name? And this can be during formal presentations and meetings or during informal gatherings. So some potential answers are explicit bias, such as institutional hierarchy, unconscious bias, like what you've heard other people say, or something else such as tradition or comfort level. So use of a professional form of address, such as doctor or professor, implies authority of the person addressed and respect by the speaker. And lack thereof may imply the opposite. So myself and several other researchers have asked, is this based on race or gender or potentially something else? Dr. Narjas Duma and colleagues looked at this at ASCO at 2017 and 2018, and what they found is that non-professional forms of address were used in 28% of introducers, and male introducers used a professional form of address for only 53% of female speakers, but 80% of male speakers. And in their multivariable analysis, males were 2.4 times more likely to be introduced professionally. So what does that mean? Why is that happening? We did the same thing at the Society of Surgical Oncology annual meetings for 2018 and 2019. And we found that non-professional forms of address were used in 30% of introductions, so similar to ASCO, but there was no difference by gender. However, non-professional forms of address were used more often by introducers of higher academic rank. And so that's the figure that you see here on the screen, that as you became more senior, you were less likely to use a professional form of address. Physicians who had not yet become faculty were 2.8 times more likely to be introduced without their professional title. This was also looked at ASTRO, and what they found is that use of a non-professional form of address actually increased over time from 2017 to 2019. There was no specific difference in the form of address by speaker gender, but what they did find is that males were less likely to use a professional form of address, and so that's what you see in the figure here. The male introducers are the red dotted line, and self-identified Asian and Pacific Islanders were almost 2 times more likely to receive a professional form of address compared to white individuals. This was looked at ASH, and what they found is that women were more likely to receive a professional form of address, so opposite of what they found at ASCO, and that speakers with MD introducers were twice as likely to have a professional introduction compared to those introduced by PhDs. And then also at the American Urologic Association, which there were very few female speakers, non-professional form of address used by 39% of introducers, and overall no difference in form of address by introducer gender, but male speakers were more likely to be introduced with a professional title when introduced by a female introducer. So what can we take away from all of this data? Unconscious bias exists in medical organizations, but the type of bias varies by organization, so we're not all the same. You might be hearing this thinking, aren't these just words? Yes and no. Respect is a demonstration of empathy that is mindful and is proactive. It requires intentional thinking, recognition of what others' thoughts and feelings are, and an intention to respond to what others actually want. It's also an important part of inclusive practice. So we should acknowledge that there's power held in the words that we use, and it's not enough that the words are not used to cause harm, but they must clearly acknowledge the power differential. So when we presented this data from SSO, the leadership responded in manuscript format. And what they suggested is that maybe first names were just used when we knew each other, or isn't tone and connotation actually what's more important? And what if people actually just want to be addressed by their first name? So we replied, Using a first name due to familiarity is also a power move. It's obvious when you listen how people are introduced when individuals know each other. This is about unconscious bias, which, as I said before, is below the level of consciousness, and so tone and connotation are not relevant here. And you know what? Why don't we just ask people how they want to be introduced on the podium? So that's what we did. We sent out surveys to everybody that submitted an abstract to SSO for 2021. And what we found is that most individuals want to be addressed with a professional title. And it's fewer than the people that are receiving a professional title address at our meetings. And importantly, we also found that there was no difference in speaker introduction preference based on gender, race, or ethnic identification. Oh, there we go. So, okay, we have this data now. We know that it's there. We know that it's real. What can we do about it? We can adopt common guidelines for how we communicate with each other to facilitate a reduction in unconscious bias and promote inclusion. And by doing so, we can promote respectful communication, which really maximizes our ability to learn from each other, and with the ultimate goal of advancing our field for the benefit of all. So Dr. Duma did this at ASCO. This was published in the ASCO Post, but this is not something that's limited to academic medicine. This is something that even exists in the US courts. So, having trouble advancing. So we created similar guidelines for the Society of Surgical Oncology, and these were distributed to introducers for our 2021 meeting. And what we found is that it worked. When we distributed these guidelines to our introducers, significantly more speakers were introduced with a professional title. So it went up from 70% for 2018 and 2019 up to 84% in 2021. So, we originally brought this idea up to the leadership. They said, how are we going to tell doctors what to do or how to speak? Well, they did. We handed this to them. We didn't say you had to do anything. It was just guidelines. But people followed them. So this is here just for individuals that may want to go back to the slide deck to see what our guidelines for respectful discourse are. I'm just going to highlight a couple of things. So for really, what's important is to strive for consistency in the form of address when introducing and speaking about others. So in formal discourse, professional forms of address are often used, right? We've been using them here all day today. In less formal discourse, first names are often used, and that's okay. But what's most important is that it's consistent use of one form of address amongst all participants, regardless of acquaintanceship in a session. And that's what really facilitates inclusivity. And we suggest that when leading a professional meeting, you might start by establishing guidelines. And so you can start by just saying how individuals will be addressed during a session, the time allotted, and the procedure if time is exceeded, when and how questions are going to be answered, and acknowledge that deviations are going to occur and that there should be respectful correction when it does happen. So this was a little faster than probably I'd intended, but I know that I'm standing between you and lunch. So this is my full contact information here, and thank you again so much for the opportunity to present today. I don't know where our microphone went.
Thank you. Interesting topic. I was interested to hear your perspective on the patient-physician relationship and the use of first names in the clinical setting versus Mr. or Mrs. So-and-so, and regarding whether you think that should be universally adopted or based on the age of the patients. And just as context, when I worked in New York, I called all my patients, Camille. And then I worked at the VA, and I called all my patients Mr. or Mrs. So-and-so. And I've been sort of interested to hear how to navigate that dynamic from your perspective.
That's a really good question. And for me, who's someone that is petite and young, a lot of people, especially earlier in my career, didn't understand my role on the team. And so I always try to introduce myself as Dr. Stewart so that they clearly understand who I am to them. Still, a lot of times people say, wait, are you my surgeon? You're the one that's been talking to me the whole time, but are you the one doing it? And I'm like, yes. And so for me, I personally introduce myself as Dr. Stewart for that reason, but then I try to give my patients the same level of respect and call them Mr. or Mrs. So-and-so, or if they have a doctoral degree, Dr. So-and-so, just to kind of make it be feel equal, or that their participation in the relationship is not skewed in some way. Now, then you can kind of take this to all different levels, right? Like, what about my clinic staff? What about my team members that are subordinate to me, like my residents? Why do I still call Dr. Fong, my chairman at City of Hope, Dr. Fong, and I will never call him anything different than that? But, my current chairman, said to me, call me Rich. And so I think these are really complex social issues that go a lot to the hierarchy that has been a very prevalent part of medicine for so long. And is there value in that hierarchy? Some people would probably say yes, and other people would probably say no. But that's also why I think it's really important that when we're at a meeting like this or another meeting like ASCO or SSO, that we all use the same form of address just to eliminate that level of bias right off the bat, right? Because if you're going to introduce me as Camille and then talk about, my male counterpart as Dr. So-and-so, it's hard for me to see how that doesn't make somebody in the audience think this person is more respected than this person. So I don't know if that answers your question well, but obviously it's a highly nuanced topic.
You kind of just answered my question. I was going to piggyback off of that. Like working in a clinic setting, being a nurse, and then with a physician, he always wants us to call him by his first name. I'm more comfortable with doctor. Is that disrespectful to him to not honor that he wants me to call him Tim? I don't know, it makes me uncomfortable.
I think that's a great question. And so I am now faculty at an institution where I did my residency. And so a lot of the clinic staff are still there. And so they call me Camille because that is what they have always called me. But my current nurse in clinic, she's new. She's only ever known me as Dr. Stewart. And so all the nurses work really closely together. So Joy calls me Camille, but Cameron calls me Dr. Stewart. And I said to Cameron, you can call me Camille. Everyone else around you is calling me Camille, and I want you to know that I do not see that as a level of disrespect. And she said, I don't feel comfortable doing that. And you know what? That's okay. I want people to feel comfortable when they work with me. And usually, when my clinic staff are calling me by my first name, I think of it sort of as like, you are my partner. This is a team. And so that's okay for me there. But I would never want any of the people that work with me on my team to feel uncomfortable in any way. So I think it's personal. And so I don't take it as a disrespect as somebody would prefer to call me just Dr. Stewart. Like, I love that. That's great. But I think it's just about open and clear communication, that using a professional title or not, in that circumstance, it sounds like it is respect, and it's a way that you respect that physician, right? I think that's okay.